us. We have had so many questions lately on Instagram, on Facebook, about the safety of donating our eggs. I've been a donor myself several times. Dr. Sharma is a fertility specialist, and I will let her introduce herself and her practice, and then we will begin with all of the questions that we have.
So nice to meet everyone. I think this is a great topic and one we don't talk about enough. We talk to the independent parents, we talk about the process of egg donation, but we don't really speak to egg donors and what they're going through. And I think that this is great that you're having this event tonight to talk about this. So I'm Prati Sharma. I'm a fertility doctor of 14 plus years. I have been working at Create here for 14 years. We are a large center for third-party reproduction, egg donor, and surrogacy. And so I've seen many egg donors through the process. And so we understand what it's like, what the side effects are, what the stimulation looks like, and how we can make this palatable and easy for our egg donors so they want to keep coming back. We're so grateful that they donate and help our patients, and so we want to make it a pleasant experience. I'm originally from New York, and now I consider myself Canadian after being here for 14 years, and I am very excited to have this session, and I'm always happy to work with CFC and Egg Helpers, so thank you for including me.
No, absolutely. So I guess my first question, before we get into the questions from the donors, is for those who are listening and curious about egg donation and wondering just about the process, if you could maybe just share who utilizes, and it's really important here for me that we use language. You know, it used to be who uses an egg donor. Well, we don't use anyone, it's a person, and we really value them. And you know, for us, you know, more than 80% of our egg donors meet and know the recipients, and we love that about our program. We're really proud of that. But who needs a donor? Why would someone need a donor?
Well, I always say we've come to such a great spot in reproductive medicine where we can help so many people. And so things like egg donation never really existed before the 60s. So when we talk about egg donation, primarily the top reasons why patients would use an egg donor is one, advanced reproductive age. So we know that the age at which women are having children has been steadily increasing, and many women are meeting their partners later on in life, sometimes over the age of 40, even over the age of 45, and we know that the natural aging process takes over. And so a woman's egg reserve, or how many eggs she has in her quality of eggs, declines with age. And so as a woman gets towards menopause, her egg reserve is lower and her eggs might not be able to function to produce a viable, healthy pregnancy. So those clients are in need of younger, healthier eggs. And we're very fortunate that we have this process of egg donation where you can actually use a younger donor's eggs, who donates her eggs, and put them into an older woman's uterus to carry the pregnancy. So that's one example. The second example is for couples like same-sex males who don't have the ability to use eggs as gametes because they're two men. So they need eggs and they need a uterus to put together with one or both of their sperm to create embryos to start a family. So this is probably the second largest or an equally large category of clients that need the use of egg donors or egg donors' eggs to help them start a family. And so those guys will choose an egg donor, whether it be a known or anonymous donor, and together they'll start a family by using the eggs from an egg donor, the uterus from a surrogate, and their sperm to create embryos. So those are really the two big categories of patients who need egg donors. I mean, outside of age, a woman could need an egg donor because she's undergone toxic therapy such as chemotherapy that's maybe made her lose the ability to have children because she's gone into premature menopause because of treatment, a variety of other reasons where their own egg reserve might not be enough to create a viable, healthy embryo. And you know, we've reached this phase where we can take one person's eggs, combine it with another person's sperm, create embryos, and put it in another person's uterus. And it's just so fantastic and amazing how far we've come with science that we're able to help so many people.
It really is. And for myself, having been a donor many times, and now my 3 adult kids donating, you know, I've really become curious about the safety when my 19-year-old recently donated, and she said, "Mom, like, is this safe? Am I going to be able to have my own kids?" And I'm like, "Oh, well, of course." And she's, you know, smart and said, "Well, show me the research, show me the studies, tell me, I want to know about this medication." She is the first person in my family, my other 2 daughters have donated, who wanted to read the leaflet from the medication and was really curious. And so, you know, it really got me thinking, you know, my goal with with Egg Helpers is to empower and educate people participating, whether that's intended parents, and especially the donors who are helping them. And so let's get going with the questions. We're going to bring them up here in a moment.
I just do want to make a comment about what you said, because I think it's important to realize for us as fertility doctors, the patient is not just the intended parent. The egg donor is our patient, and the intended parent and the surrogate, they are equally our patients. And so those are really important questions to ask. And like just to touch upon that, because I think that people don't really understand that IVF is safe. IVF is not using up your eggs. So for potential egg donors, just sort of a simple two-liner to talk about reproductive physiology, you are granted a certain number of eggs, every woman is, but every month you're given a group of eggs, and it's use them or lose them. Those eggs are gone no matter what you do. Like, you're not saving them if you don't do egg donation, right, or if you take the birth control pill, and you're not losing them if you do IVF. You're actually just rescuing eggs that would otherwise be gone. So when a woman donates her eggs from 1 month, she's just saving ones that were otherwise lost, and she's not taking away from her pool of future eggs. So it doesn't reduce your fertility. It doesn't put you into premature menopause. It's not taking away from the eggs that you could use to have a healthy baby. It's just rescuing the ones that would have otherwise been lost and helping another client, couple, intended parent have children with those. So it's an incredible gift.
Perfect. So the first question, can I touch on how to become an egg donor? Absolutely. We have a great team who will walk you through the process, talk to you about your family health history, fill out a profile form, finding out from you who you'd like to donate, if you'd like a no donation and donate to a same-sex couple or heterosexual couple, a single person, and we'll really get a lot of information from you, and then you'll meet with a fertility clinic in your community and have some testing done. So having some genetic testing done, having some testing to look at your fertility levels and to see if egg donation is a possibility for you. And it is all done at the cost of the intended parents. And so as you're going through the what I call the curious stage, or the information gathering stage, we will support you, and we will ensure that all of the questions you have are answered to decide if this is a good path for you. Next question. Okay, will donating my eggs affect my period? If so, for how long?
I think I can take that one.
Perfect.
So as I alluded to before, basically what you're doing during egg donation is stimulating multiple eggs to grow in one menstrual cycle. So in a normal menstrual cycle, which is approximately 1 month, one egg grows, ovulates, and then if you don't get pregnant, you shed that lining. So what we're doing with the advent of fertility drugs is we're accessing the other eggs. So instead of ovulating 1 egg per month, you're going to ovulate 10 or 12 or 15 or probably 20 to 25, which is essentially around what number we really want. And so you'll ovulate multiple eggs, and you'll still get a period 2 weeks later. Now, mind you, because you are taking fertility drugs, that particular cycle might be a little bit off. It might be a little bit longer, it might be a little bit shorter, but once you've done the donation, your next cycle should go back to normal. There are side effects because you're ovulating multiple eggs. You feel a little bloated, you can feel some hormonal side effects, and so traditionally we say take a month off before you donate again, and we tell that to all our patients, not just our egg donors. But in general, your periods should remain relatively the same. And we tell egg donors who are on the birth control pill, you can do your donation, get your period 8 to 14 days later, and you can go back on the pill as per usual.
Are there any specific things I should bring to the clinic for my appointments? We suggest to all donors to make a list, to bring your questions, to really have a list of things that you want to know about your own health, about how the IVF cycle is going, as you're preparing for the process as well. Any medication that you're using, so the clinic can adjust it, show you how to use it. That teaching piece is really, really important. Okay, so from the time that someone fills out an application with our agency, or I would say with an agency, generally through that process, the testing, the genetic testing, all of the testing that needs to be done prior to getting started takes a couple of months to complete. And so most donors, from the time of application to the time of actually going through the process, it's typically about 3 months. And what's really important to know as you're accessing or researching donor programs or donor agencies is ensuring that they are working for you around your timeline. Intended parents are so grateful for the gift that you're giving, and they're willing to wait until your semester of school is over, or your wedding is over if you're in that stage of life, or your kids are back at school. It's really important that you provide that information and ensure that the agency you work with is accommodating of it. This question is asked all of the time, and Dr. Sharma, I know our guests can see it, so I'm not going to read it, but if you could talk about that. It's really great.
So again, doing IVF will not affect your fertility if all goes well, or your ability to have kids. And you know, I think there's a lot in the media suggesting that fertility drugs aren't safe, or they put you into menopause. And so I try to be a myth buster in that sense as a fertility doctor, because we're all, we all succumb to the media. We're all on Instagram. We're all looking at what celebrities do. And I think you have to be very careful. So I think IVF, if done properly in a reputable clinic, without complications. And I add that to say that any procedure can have complications. When you do an egg donor cycle and you stimulate and you do IVF, there is an egg retrieval. It is a process where we go in, we extract eggs by putting a needle into the ovary while you're asleep to get the eggs out to give to the lab. Any procedure that you do has risks of bleeding, infection, or damage to any structures nearby. It is less than 1% risk with an egg retrieval, but yes, of course, those are potential complications. And certainly if any of that happens to you, there is maybe somewhat of a risk of future effect on fertility. But I can tell you, I've done thousands of egg retrievals, and it is truly less than 1% risk, and the ability to affect your fertility is almost 0%. So as I said before, we are not taking away from your pool of eggs. We are just taking the eggs that would have been otherwise lost in that menstrual cycle and rescuing them to utilize for your intended parent. So your fertility or your egg reserve or your ability to have a healthy child because those young eggs were taken away, that does not exist. That is not possible. You'll just have another group of eggs that crops up in the next month. So your ability to have kids in the absence of complications should not be affected at all. How long after donating should I wait to conceive? That's actually a great question, because most women who are doing egg donation are very fertile. That's what we want for our egg donors. So I always say be careful during the egg donation cycle. So because you're creating multiple eggs, and you know, of course we're going in and taking out the majority of the eggs, that's not to say a couple of eggs are going to be left over in the ovary after your egg retrieval. And if you have unprotected intercourse that cycle, you could get pregnant and you could have multiple. So we always say do not have unprotected intercourse around the time of the egg retrieval or within that cycle because of those risks. But truly, in the absence of any issues with your next menstrual period, you can absolutely go on and try to get pregnant. I would probably say that in the first period after your egg donation, because your body was kind of revved up on fertility drugs, there probably is a tendency towards multiple risk in the cycle right after, so maybe be a little bit more careful in that cycle, but there's no reason why you can't try to conceive almost immediately after the egg donation month.
We have many donors who have had amazing, wonderful surprise pregnancies after donating, so absolutely. Oh, this is great. What safety precautions are put in place to ensure my health as a donor, and are there follow-up appointments? So I want to, as the owner of Egg Helpers, and I know that other donor agencies share this value, we work with clinics that care for the donors in a very specific way, from the screening process to the retrieval to each and every process that they go through, including your physical health as well as your mental health. And counseling is available throughout the entire processes. This is a big deal, and we want donors to take this, and intended parents to take this process so seriously. And having that support for the mental health to us is really key. And I'll let Dr. Sharma talk about the health and the physical health and well-being of donors.
And I mean, I should start out by saying the donor is just as much as our patient as any other patient that walks through the store. So the health and safety of the egg donor is of utmost importance. And I think that starts with the initial consultation, whether it's with the physician or one of our other allied health professionals. Our goal is to make sure that you're a safe candidate. I mean, we obviously want egg donors to have good egg reserve and be candidates that are going to produce enough eggs, but we also want to make sure it's healthy and safe for you to do it. If you have any other chronic medical issues, that they won't be affected. There'll be no drug interactions. Again, that your mental health is such that you're going to be okay with coming in and taking needles and all of that stuff. So that initial appointment is very important. I think a donor should always remember that any of the medical tests that are done deserve explanation to them. So let's say as a donor, you come in and do your fertility testing and it's borderline or a little bit low, and we say, this might not be perfect for you to donate. I can speak for myself as a fertility doctor, and probably most fertility doctors, but I would happily have further consultation with my donors to talk about their own fertility and what that means for future conception if they're, let's say, on the lower side. When it comes to going through the process, as you come in and do your stimulation medications, you're having checkpoints of getting ultrasounds and blood works. So number one, assess your response, of course, to make sure you're doing well. But number two, we always ask, how's it going? How are you feeling on the medication? Are you bloated? Do you have any side effects? Is there anything that we can do to make this better? Should you take the injections in the evenings rather than the mornings? Are you getting headaches? And so those are all things that our nurses and in the back end, us as physicians, are also looking into. At the time of the egg retrieval, the donors are under sedation to make sure that it's a pain-free process. Obviously, we're making sure that it's done in the safest manner to avoid complications afterwards. And I'm sure donors know the buzzword of ovarian hyperstimulation syndrome, or OHSS. We are very, very cognizant of OHSS in our fertility clinics, not just at my clinic, but every clinic. We all want to be OHSS-free clinics. And so our protocols are designed to, yes, access a good number of eggs, but also allow for the fact that our donors do not experience OHSS, that they're on the proper medication protocol, the diet protocol after their egg retrieval to make sure their risk of OHSS is lower. We use specific stimulation protocols, specific trigger medications to avoid OHSS, and every donor is seen afterwards and checked in with to make sure that their symptoms are appropriate for after an egg retrieval and that there is no risk of OHSS, infection, bleeding, or anything like that. And God forbid, there is something to suggest something's going on, we are here for follow-up to manage those situations as safely as possible and make sure you get through it appropriately. So, from before the retrieval, from the consultation and the counseling with regards to whether this is right for you, through the IVF cycle, there are many touch points to make sure that the situation is going smoothly, and then after the egg retrieval to make sure that the follow-up is in place. I think that's standard operating procedure for the clinics that are doing IVF on donor patients.
Absolutely, thank you. Okay, this is a great question. Do genetic disorders bar you from donating eggs? And Dr. Sharma is going to talk about this from a medical perspective. I'm going to talk about this just for a brief moment. I did my first egg donation nearly 20 years ago, and there was no genetic testing done. You just were they were so grateful to have you donate, and so it didn't matter. You just became a donor and gave your eggs. And it's fascinating to me now that there is genetic testing done. And Dr. Sharma, if you could talk about what that testing is, and what it looks for, and then what would bar someone from being a donor.
We kind of hit the nail on the head. We are in this age where genetics is huge. And so I think many people just go get 23andMe just for the heck of it, right? Yeah. So lots of times patients come to me with a diagnosis of they're carrying some genetic situation. And so the question is, it's up to us as physicians to sort of decipher that and say, okay, what are the risks that this can pass along to a child for the intended parents? And what are the risks for you? And every genetic disorder is different. And there's so many of them, and we're fortunate to have great genetics counselors that can talk to patients about this, so that's the first thing. Yes, certain genetic disorders can be an issue when it comes to donating, and those particularly center around some of the blood clotting disorders because they predispose you to a risk of blood clotting, and hormones and hormonal stimulation can increase the risk of blood clotting. So that's a small subset of genetic disorders. But other genetic disorders, it depends on what their inheritance pattern is. So if you are a potential egg donor and you have an autosomal dominant disorder, so a dominant trait is one that's going to automatically be passed on and most likely expressed in the child. So for example, like Duchenne's muscular dystrophy or something that's an autosomal dominant disease, that could be an issue because that is going to pass along to the child, and for intended parents, obviously they don't want that risk. There are other genetic disorders that are recessive disorders. So these are in the background, and you need 2 copies of the gene to be able to pass it along. And so many egg donors are pre-screened or have had a screening, or their intended parents ask for this screening because they want to make sure they search for all these genetic things, and you, as a potential egg donor, might be a carrier for a recessive disorder. That does not preclude you from being an egg donor. We just need to make sure that the sperm source, so whether that be a same-sex male, donor sperm, or a heterocouple's male partner, we have to make sure that that person is tested and that they don't have the same gene, so that when it matches up, the child has a 25% risk of carrying the disorder. So again, to sort of simplify this, it really depends on what the genetic disorder is, what the clinical outcome of that genetic disorder can mean, either to a potential child or the egg donor, and how it's inherited, and other testing that can be done to see if that can be an issue for the child. So again, I wouldn't say if you have a genetic condition to say there's no way I can do this. I think you just have to get the right information, speak to a fertility doctor, probably speak to a genetics counselor as well.
Absolutely. And so as you're filling out your profile, you would list if there is a genetic condition that runs in your family. All those questions will be asked, and we ask donors to just lay it all out. We want to work with you, we want to make it work, and we want to ensure that you have all the information around your health, and that includes this genetics information and having a consultation should there be something come up with a genetic specialist, which is amazing that's available here at Create and the clinics that we work with.
I should also mention that in addition to these carrier screens and things like that, certain ethnicities predispose you to potentially carrying a genetic disorder. And so if you're Mediterranean or African American or South Asian like myself, we have a predilection for carrying sickle cell or thalassemia. And so these are standard things that we test for. It's important for you to know as an egg donor for your future, but it's also important for the intended parents to make sure that doesn't potentially pass along. And it's just part of our due diligence.
Excellent.
Yes, do you want me to take
that
one?
Please.
Okay, so the medical process for an egg donor involves a consultation with the doctor, where just like any other medical consultation you would have with a physician, we go through your history. We particularly focus on the gynecologic history and any medical issues and surgeries, because that will pertain to your becoming an egg donor. So we're interested in your age, whether you've been pregnant before, how your menstrual cyclicity is, if there's any gynecologic issues like pain, ovarian cysts, fibroids, because that can interfere with your production of eggs and access to the ovaries. Any chronic medical issues that could affect being stimulated, or surgical procedures, particularly in the belly, that can affect the egg donation process. We always take a mental health history. We want to find out about your social history, any toxic habits, weight, height, and a physical exam. So those are things that are going to be important in the consultation and the physical exam process. The medical screening that egg donors undergo includes genetic profiling, as we talked about, to make sure you don't carry any inherited disorders that can pass on to a child. Blood testing for your ovarian reserve, so how many eggs you have and how healthy they are. The major 2 tests for that are the egg count on ultrasound, so you will have a pelvic vaginal ultrasound to look at the ovaries, tubes, and uterus. The antral follicle count, which is the egg count, and AMH, or anti-Mullerian hormone level, that looks at your fertility, as well as basic blood tests for reproductive hormones, including the thyroid, a hormone called the prolactin, and STD testing, which is a requirement per Health Canada, just to make sure that obviously there's nothing there. We also do a urine toxicology screen to make sure that our donors are not using any illicit substances that can obviously affect the donation and are also just not good for them when paired with fertility drugs and anesthesia. And then in terms of once you've been cleared medically and it's time to go on with the egg donation process, the process involves 2 weeks of your life, essentially. It starts on the 2nd or 3rd day of your menstrual period. Many egg donors will be put on the birth control pill just to regulate their cycles or get them to get their period at a certain time that's convenient for them or convenient for the recipients who are going to be coming in and giving sperm. On day 2 or 3, you start medical treatment with injectable medication. Those are hormones, FSH and LH typically. Those hormones are injected into the tummy daily for about 10 to 12 days. The days that you're at the clinic, usually the nurses help inject you. The days you're not here, donors are very capable of doing those injections on their own. That process takes about 10 to 12 days to grow and develop the multiple eggs or follicles. During that period of time, you're in the clinic every couple of days to get blood draws to assess your estrogen level, as well as ultrasounds, vaginal ultrasounds, to assess the follicular or the egg growth. And so as those eggs grow, we monitor to look at the sizes, look at the estrogen levels, make sure the appropriate number of eggs are developing, change the dosing and medication if we need to. At the end of those 10 or 12 days, we say, okay, the follicles are at the right size. Typically it's 18 to 22 millimeters. Once they reach the right size, we trigger ovulation. We say these eggs are ready to go. Ovulation is triggered, and 35 hours later, we perform the oocyte pickup or the egg retrieval. That's a procedure that happens in the clinic, in our operating rooms that we have right in our clinic for the most part. An IV is placed in your arm, and you get medication that puts you to sleep. It's called conscious sedation, so it's Twilight. Most egg donors are asleep and perfectly comfortable. As the fertility doctor, I come in, I clean the entryway through the vagina, and then we use this transvaginal ultrasound with a needle guide and ultrasound guidance where we see the ovaries and we access the ovaries through the vagina and retrieve the eggs. You're asleep during the process, so you shouldn't feel any pain. If you feel any pain, we can give you more medication. Those eggs are taken out and given to the lab for the process of fertilization. The whole egg retrieval takes about 15 to 20 minutes. We look to make sure there's no bleeding and everything looks good. The egg donor stays in our recovery area until they are recovered from the medications. They can eat properly, get up and use the restroom, walk, because we want you to be able to leave and go home in a safe manner. That's usually about half an hour to an hour, so you're in the clinic for maybe an hour to 2 hours. And then we see you the next day or within the next day or two to make sure that your post-retrieval check looks good, that there's no evidence of fluid buildup or hyperstimulation, that there's no evidence of bleeding, that you feel well after the process, that your side effects are, mostly resolved. You are going to feel some bloating and cramping. And then our nurses reach out over the next week to make sure that you're recovering well and that you get your period and everything's back to normal. Anything else I forgot to add?
I think that's great. Absolutely. Oh, that's a good question.
Great question.
I would love for you to answer that.
Yeah. So every clinic has its policy. I mean, for the most part, we haven't quite gotten to full oral medication for IVF, but there have been some interesting and very cool developments in IVF, and I like some of these things have been incorporated into our clinics, and some of them are sort of just on the up and up. So there's really a couple of medications that are important. One is the medication to stimulate the ovaries, and that's the FSH and LH, and those are predominantly injectable. There are oral medications to stimulate ovaries. The problem is these are very low dose, and they don't stimulate the ovaries enough to get that target 15 to 25 eggs. And so, yes, it's possible to use only oral medications, but we'd be getting 3, 4, 5 eggs, and that's not going to produce an optimal result for our recipients. And so, generally speaking, the medications are, for the most part, injectable. Sometimes we combine them with the oral medications to keep hormone levels low. The other injection is called an antagonist, and it's what keeps the body from ovulating the eggs before we're ready to take them out. So interestingly, there is an oral antagonist available, and we have started using that in some of our clinics. So if you are completely opposed to too many injections, that there is a consideration for that. The answer to can the medications be mixed together? Yes, absolutely. The FSH and LH medication are absolutely mixed together, so that's only one injection. Typically, it'll be one injection a day for about 10 to 12 days, and the second half from day 6 through 10, 11, 12 is a second injection. That's the antagonist, although we have oral medications that can be used as a substitute for that. So yes, our protocols are getting more and more streamlined to make them easier for patients. I hope that one day we do achieve full oral IVF and we're able to achieve the success rates that we can. It's probably not too far away, but for now, it's not bad. We used to do IVF and it used to be a 4-week process where you'd be taking injections for 4 weeks. Now we're down to 2 weeks with some oral and some injectables. So I foresee in the future that hopefully will be all oral.
Oh, huh. Why does history of drug abuse exclude participants? Is there a way to become an egg donor if you've had a history of drug abuse in the past, for example, cannabis? We have found in recent years with the legalization of cannabis that there's this question mark around cannabis use and IVF as there is around nicotine, and so we look at cannabis in a very similar way as an agency to nicotine, knowing that it's not safe to smoke during hormonal treatment is our understanding. And the doctor, when they prescribe you the birth control, they always say you shouldn't be smoking or taking the birth control pill, and we've used that as our guide, but I'd love the sort of medical.
Yeah, I mean, listen, as a fertility doctor, I'm never going to be able to say it's okay to smoke, or it's okay to use marijuana, or it's okay to drink alcohol to an extreme. But I'm a believer in anything in moderation. I think that marijuana and alcohol are in a little different category than smoking.
Okay.
We know that smoking has an effect on egg quality, and chronic smoking puts women into premature menopause. So just as a counseling point, I think smoking has an effect on egg quality. I would tell any patient, including an egg donor, that it's not good for you.
Really? Okay.
That being said, we all know that there's degrees of smoking, there's degrees of drinking, there's degrees of marijuana. Like, people say I only smoke when I have a drink, and it's really occasional, right? Is that going to ban you from being an egg donor? No, not necessarily. But certainly if you are a chronic smoker, it's probably going to be reflected in your ovarian reserve. And I agree with you, you shouldn't smoke while you're doing the stimulation. Mind you, a lot of trust is in this process, right? Because we're not doing urine toxicology screens every day on the egg donor. If it shows up that you use nicotine, we will say, retest in 3 to 4 weeks, and hopefully you're smoke-free for a good period of time. If everything else looks good, it's not unreasonable to consider being an egg donor, but every situation is different. I agree with you, marijuana is tricky. It is legal, right? You can't say you can't be an egg donor if you use marijuana. There are some effects on fertility with chronic marijuana use, so I think I agree with you in terms of marijuana, saying absolutely lay off during the stimulation process, but I don't think we can say downright, like, you can't ever use it. Now, you notice the question saying, why does a history of drug abuse exclude participants? I mean, there's so many drugs out there, right? And so I think marijuana is on the lower end of drug use, especially because it's legal, but I think a history of amphetamine use, or anything that's, more on the higher level, it's not really just that use of drugs. I mean, everybody's probably tried once, right, when they were 16. So that doesn't preclude you from being an egg donor, but it's more if there's current and ongoing use, is there some sort of underlying psychosocial or mental issue that might make it not optimal, not just from the medical perspective, but even the psychological perspective for the egg donor.
And I look at it that way as well. When we look at the donor process, it's honestly a wonderful process. I've been a donor. My kids have been donors. I believe so deeply in helping people become parents. And with that said, it is important that if you have mental health issues or if you've struggled in the past, to really surround yourself with social support as you go through the process, because it is a big process. Hormonal medications, create a hormonal effect within our body, and so just to be safe and ensure that you have support around you so that you may not fall back into habits of drinking during your donor process, which is maybe a coping mechanism that you picked up during COVID, like many of us did, or cannabis use or smoking or whatever that is for you. And so when we're doing your intake and when we're having those conversations around, who's going to take you to your egg retrieval? Who's going to pick you up? How can we support you so that those supports become your supports rather than maybe falling back into some habits that maybe weren't the best for you? This one,
quite frequent. Yeah.
I want to know about this because we have donors all the time that have ADHD, university students, real bright kids. They want to be egg donors, and we have found that some fertility clinics ask that they abstain from taking ADHD medications while others do not. And so I love, what does the research say?
I mean, I think it's medication dependent. It's funny, in the past there was only a couple of medications for depression, right? Now there's so many. I don't know the effect of every depression medication. I don't even recognize the name. So I always say take it back to your doctor. Before we decide if you can do it or not. I mean, the standard ones like low-dose SSRIs are completely fine. Remember, these donors are not getting pregnant, and so just to donate eggs, it's fine. I mean, if I had to make an overlying statement, I'd probably say most medications for depression and ADHD are okay during the egg donation process. But that's if you have a single medication for ADHD or depression. If you're on 5 different medications for both, that they can interact with each other, they can interact with the sedation meds, and again, going back to what we talked about, that if your mental health is not stable, you might not be able to do this. But I think, let's face it, a huge amount of the population is on a low-dose SSRI.
Right.
Not just egg donors, everybody who
Right.
walks through the door, right? So because of that, we do have data, and it's really a risk benefit. Like when you talk about getting off of it, you're absolutely right. Like for a patient who's on a low-dose SSRI for anxiety, and that's important for them to function, even in pregnancy, patients continue to take those because it's a risk benefit. If you're not on it, you're going to be unstable. And so doctors will say, stay on it during the first trimester, or stay on it for some period of time. So I think it's really a risk benefit as to how many drugs are on, what the effect is in pregnancy, and we extrapolate that to the eggs, and what the actual class of that medication is, and if there's an effect on egg quality. Again, low-dose SSRIs, which is really predominantly what we see, or low-dose ADHD medications, they're fine during the egg donation process. It shouldn't be an issue. Yeah.
This one's interesting. We get a lot of questions on Instagram, and we have Sarah recording, so she might have other questions for us as well. You know, I'm 33, I have 5 kids, why can't I donate? Or my BMI is 34 and the cutoff is 32, and you know, are you an ageist? Are you a weight snob?
Yeah, it's a great question.
What is it?
It's a great question. I mean, I think we need to all have certain parameters for sure,
Okay.
right? So, and on the flip side, intended parents ask me every day, what am I looking for when I look at an egg donor?
Okay.
And I look at a profile. So young age, we know age is associated with fertility. So in general, we do say we prefer women who are under the age of 30,
Okay.
non-smokers with a normal BMI. And just to sort of like go through those a little bit, we know that women's fertility declines with age, and over the age of 30, and it's actually occurred even over 20, but typically over the age of 30, you start seeing a decline in fertility. So naturally, you want a younger woman to donate eggs. It doesn't mean a 32-year-old can't be a good egg donor. I'll come back to that in a second. Non-smoker, again, goes back to the data that smoking does have an effect on egg quality. So ideally, it's better to have a non-smoker because their egg quality will be better. BMI is an interesting one. And this goes not just for egg donors, but anyone doing IVF. At some point over a certain BMI, access to the ovaries can be trickier. And again, we want this to be a safe process. And so if your BMI is significantly over 30, those ovaries might be high up there. We have to push and pull. Your risk of complications during the egg retrieval is higher. But again, it's a spectrum, right? Okay. Egg donors, like what we've said throughout this process, is an incredible gift. You know, sometimes finding egg donors in a particular ethnicity can be difficult, and I think we can all attest to that. And so is it a deal breaker if a 30-year-old or 32-year-old, as in this question, wants to donate? No, absolutely not. In fact, I'd be the first one to say screen a 32-year-old egg donor in a particular ethnicity or a known donor, because a 32-year-old girl can have better fertility than a 28-year-old girl. So I think there are all these fuzzy areas, and we have to keep an open mind. But as an agency and as a clinic and for our intended parents, we do have to have certain parameters to give our patients and to have as a clinic, so that, you know, we're not having 40-year-old egg donors come through the door, because that's obviously beyond the age that we would like.
So in Canada, the law is really clear, and I've been working with Fertility Advisors, an organization that I started to work with the Canadian government on finding another alternative. And in Canada, currently, donors cannot be compensated for their participation as egg donors. And so there is a reimbursement process. And that process is to ensure that there are no out-of-pocket expenses, that a donor taking that 2 weeks off work is covered, that the donor's meals while she's traveling, her mileage are covered, her childcare, her pet care, health and wellness products are covered. We want to make sure that this process is as comfortable for donors as possible, and that they do feel as though they have been taken care of throughout the process and not put out in any way by a clinic, having them wait too long, by us not reimbursing them in real time. We want to make sure that donors really are appreciated in every single way that we can. When donors are excluded, you know, we ensure that the nurse practitioner who has done their medical screening connects with them. The it's really important for us to know that while you may be excluded as an egg donor, that doesn't mean that you will not be able to go on to have your own family. What it means is that through the donor process, there is something that is really being looked at, which is, can we garner or can we collect enough eggs for a recipient who often may have a fertility issue, have a good enough shot at conceiving. And so we have had many donors that we've kept in touch with who have been excluded from becoming a donor and have then discontinued smoking, had their IUD taken out, for example, or stopped being on the birth control that they've been on for 12 years and come back and have participated. And some haven't been able to participate, but they've had the information. And I think information is a couple of things. It's, empowering, and it will allow you to make decisions around when you are going to build your family, if building your family is in the plans. And so we are so grateful to clinics who provide that follow-up and who often will refer a donor to a fertility clinic for, to themselves even. They'll work with the donor to go ahead and conceive herself if that is an issue. So I don't think anyone ever needs to worry. I think people need to get information, education, empower themselves so that they can make the best choices going forward. There are so many options available for those wanting to build their families.
I think we should also, though, be careful because, let's take AMH or egg reserve. I think, donors come in and people, I shouldn't even say egg donors, all women get very attached to that AMH number. So, and when we talk about science and data, your AMH level, if you're not an infertile person, does not correlate with your ability to get pregnant. Right? And research has actually shown that your natural conception rate is not associated with your AMH in the non-infertile population. So for example, if a 25-year-old egg donor comes in and has a low AMH and they're excluded from the program, and as you said, you're correct, because we need to have certain parameters of how many eggs we can get for the recipient. Right. I think that women feel like, oh my God, is my fertility low? But I've had tons of patients with low AMHs that conceive naturally, because it doesn't really mean anything if you're not infertile. So I would say for those donors who maybe are concerned about that low AMH, absolutely, you can use that as a guide to consider when you'll get pregnant, consider fertility preservation, egg freezing, all of those things, which we all offer as fertility doctors. And I'm actually a proponent of getting your AMH checked early because I think there is some meaning to that number. But I wouldn't ever think that just your AMH defines you and it means you're not going to have a baby.
Excellent. So absolutely, in order to be reimbursed for an expense, there has to be an expense. And so we work with our donors to ensure that, if it's a plane ticket, we're purchasing the ticket. If it's a hotel, we're booking the hotel, and then we have the receipt in real time. But if you have an out-of-pocket expense, we're going to work with you to ensure that you receive the money the day that you had the expenditure. Absolutely. This is a tricky one for me, having been a donor 6 times throughout my life, having been a surrogate twice, having my own 5 kids. And I often wonder, and I'm curious almost, because there is this sort of camp that talks a lot about the safety of egg donation, around over-donating, and why the American Society of Reproductive Medicine says donating 6 times is sort of the number. And we get comments every day saying that this medication causes cancer. I know you touched on it earlier. My question is this, but in a different form. When we rely on drug companies to do studies, how do we know that they're accurate?
I mean, all the studies out there are done by drug companies for sure, right? Like, there's plenty of studies that look at the effect of IVF and hormone stimulation on cancer. Really? Like a Cochrane database. There's tons of great studies.
Okay.
I think this is another sort of mythbuster media thing, right? Like, I think there's been a lot recently in the media saying that fertility drugs cause cancer. That's absolutely not true.
Okay.
Yes, it's hormonal stimulation. Like, I don't think we can lie about that. It's hormones that you're putting in your body. But the data shows that you can do up to 12 cycles of hormonal stimulation, whether that's IUI, IVF, FET, hormones for being a surrogate, without increasing your risk of hormone-dependent cancer.
Wow.
That being said, we're not telling anyone to donate their eggs 12 times, and it's probably an additive effect. But doing 1, 2, 3 donations and up to 6 donations is probably perfectly safe, and maybe a few more, because the magic number is like 12. I mean, we have to also consider the fact that breast cancer is one of the most common cancers in women, and so is endometrial cancer. Both of those are hormone dependent.
Right.
So the data gets really colored and mixed, because probably a woman who doesn't do any hormonal stimulation has a 1 in 8 chance of getting breast cancer, right?
Okay.
So I don't think doing IVF or taking medication as an egg donor a couple of times is going to increase your risk of hormone-dependent cancers. Now, mind you, if you have a strong family history of breast cancer, if there's a history of BRCA, the gene that predisposes you to breast cancer, yeah, those are other hits that can increase your risk. So those are
And do you
important.
test for those in egg donors?
No, so we don't test for BRCA unless there's, significant reason to.
Okay.
And universal screening is not accepted across the world. Like, you can't just walk into the door and ask someone to screen you for BRCA.
Okay.
It's only if you meet certain criteria that you would get screened for that.
Okay.
So and certainly
And would a history of breast cancer, like the mother, the grandmother, would it preclude
so
someone
for
from
sure,
doing
I
it?
think as any doctor, a family doctor, a fertility doctor, if I hear a patient say, "Oh, I had 3 first-degree relatives who had breast cancer at 30,"
Right.
my alarm bells are going to go off. But
Okay.
having a grandmother who got breast cancer at 80,
Right.
that's like everybody has that, right?
Okay.
So again, there's degrees of where we worry, but I think in answer to this question, taking medication in the form of IVF for 2 weeks, 1 or multiple times within a reasonable number, I think is perfectly safe and is not going to cause you breast cancer or uterine cancer if you have no predisposing risk factor. I mean, never say never. There could be an association and you might get it later, but it probably has nothing to do with your stimulation.
Okay.
So in your case, hopefully I wouldn't worry.
Yeah.
That being said, I mean, look, this is not a recommendation, but I think for an egg donor or someone who's undergone multiple stimulation cycles, I don't think it's unreasonable when you hit 40 to do mammograms every year. 40 to 50 is that gray zone where they say, oh, you don't really need anything till 50, but maybe because you've been through stimulation cycles, it's okay to screen a little bit more so you're looking, but it's by no means a direct correlation. I think it's just being proactive.
Perfect.
Yeah.
Thank you.
And the answer to the ASRM and 6 stimulations, I don't think that's just around hormones. I think it's just poking the ovaries so many times can lead to scar tissue. It's another procedure. So 6 to me, personally, I think I agree with the ASRM guidelines. I think 6 is a very useful number. I'm not saying more than 6 is not possible or it's going to harm you. It's 6 is very reasonable, I think. And I think most of our donors do stay within that reasonable limit.
Absolutely.
Oh, what can go wrong and how often can it go wrong? Yeah, we touched upon this a little bit. When we talk about complications with regards to an ovarian stimulation cycle for IVF and egg donation, the things that can go wrong are problems with the egg retrieval. So that's bleeding, infection, or damage to structures nearby, like injury to the bowel, bladder, or kidney, or ureters, anything in that vicinity. Again, less than 1% of the time that happens. Ovarian torsion, which is twisting of the ovaries, which I've seen a couple of times, thankfully, in my lifetime, is a surgical emergency, and it can happen as those ovaries stimulate, they flip on themselves. And so it's not common, but if an egg donor or anyone undergoing IVF has severe pain during the egg donation process, or even after the egg retrieval before their ovaries shrink back down to size, it's important that you're cognizant of that, and then you go to the emergency room, because if that ovary is twisted, it needs to be untwisted. Again, fortunately, less than 1% of the time. Hyperstimulation syndrome, which is excessive bloating, accumulation of fluid inside the belly. Historically, even in my time, in the beginning of my career, we used to see it a lot more often, and patients would be potentially sick and even admitted to the hospital. Fortunately, and I think due to advances in reproductive medicine and our refining of protocols, most of our clinics are OHSS free. It's not completely OHSS free. Maybe we see a case here and there, but thankfully it's typically mild, managed in the clinic, and again, under 1% of cases. Is it curable? Yes. Thankfully, most complications of IVF and egg retrieval, if identified early, are very curable. Good question, yes. The tubes are not important for IVF. We're bypassing the tubes completely, and so yes, absolutely, you can still donate. Pretty simple yes answer to that one.
Excellent. And we have many donors who have had their suicide.
Twilight. Yeah, so that's a great question too. So we call it twilight or conscious sedation because you don't have a breathing tube inside. So when you undergo surgery in the hospital, there's a breathing tube and a machine is breathing for you. So this is not that. You are actually breathing on your own. So you're semi-conscious and your lungs are functioning. So is there an option to be put under sedation, not just twilight? So there's degrees of twilight. So some of our patients are completely pain-free, but they have their eyes open and they're talking to the nurse and they actually see their eggs on the screen. As long as they're pain-free, happy, breathing, that's fine for us. But absolutely, if a patient needs to be put under more, they can be, so we can give more medication, but we have to make sure you do breathe on your own. So it's a bit of a balance there. We don't do full-on general anesthesia with the intubation in our clinics because you have to be in a hospital for that. But we do get close to pretty general anesthesia, and patients who want to be completely out and asleep, they can be. It's funny, most patients actually want slightly the opposite. They are worried about waking up after the anesthesia. And so, I think there's two things. Patients worry about pain during the procedure, and so we're very generous with medication, obviously taking care that the patients are able to breathe on their own, and patients worry about not waking up. So I think we're lucky in most clinics, we do like 10, 15 retrievals a day, so we're pretty good at the anesthesia, and so we achieve that sweet spot most of the time.
And I think as well, having been in, I want to say hundreds of retrievals of donors that I've worked with, it's really important that you're able to advocate for yourself around pain management, around maybe any anxieties that are coming up for you as you're going through this process. And, leaning on your agency support person. At Egg Helpers at our agency, it happens to be my daughter, Christina, who has been a donor herself, as almost all of our staff at Egg Helpers have donated as well. And it's really important, this process is so personal, and we want to ensure that a personalized approach is taken. And so sometimes it is sharing with the nurse or the physician that they're anxious about the retrieval process, and they're able to ensure that when you come in that you're cared for in a really specific way to help some of that anxiety subside as you go through this process that has there is no greater gift than life, and your gift as a donor really will not only create parents, but it will create grandparents and aunts and uncles and siblings in some cases. And I know for myself, having donated, it has changed who I am as a person, and being able to share with my children my experience of donating. And my 6 and 8-year-old, we talk about it, and it's really funny the way they sort of see egg donation. And so if you are a mom and you're considering egg donation, please reach out to us. We would love to share with you how sharing this with your children is such a gift. And they already think you're amazing as their mom. This really will showcase selfless giving, and that gift that we give our children of our example is just really beautiful. So I would love to thank Dr. Sharma for her participation, and please, any questions, please reach out to us, and you can find Dr. Sharma on Instagram at Dr. Prati
A. Sharma.
There you are, and we will send out a recorded version of this because we're almost at an hour. There's a lot of information, as well as how you can find Dr. Sharma on Instagram and follow her for, I would say out of all the doctors I work with, she posts the most research-based information and studies. And so if you're curious about the medical side of it, definitely follow her for all of that. So thank you so much for joining us, and thank you for being here.
This was fantastic.
Excellent. Thanks so much.